Your healthcare rights, consent, capacity, and confidentiality. Every person who receives healthcare in the province of Ontario has certain dignity, privacy, and treatment rights under the law. This includes teens, like you, who may attend healthcare appointments with their parents or by themselves. In this video, we will discuss the concepts of consent, capacity, and confidentiality, and what these mean for you and your healthcare rights. Number 1. Consent. Consent means giving permission for something to happen, or agreeing that someone will do something for you on your behalf. For example, sharing your phone number with someone means you give them consent to contact you. Or, when you install a new app on your phone, it may ask for your consent to know your location or send you notifications. Consent plays an important role in healthcare. Your healthcare provider, for example, your doctor or nurse, should ask you for your consent before any test, treatment, or procedure. This can be verbal, for example, saying yes or no, or written. By giving consent, you agree to let them do the test, treatment, or procedure. There is no minimum age to consent to medical treatment in Ontario. To give consent, your healthcare provider needs to know that you are capable or have the capacity to make a decision about your own health. Number 2. Capacity. Capacity relates to your ability to make decisions about a specific treatment. In healthcare, this means an ability to make decisions about your own health. Babies and small children don't have much capacity, meaning they can't make decisions for themselves. As you get older, you have more capacity to make decisions, which allows you to have more responsibility. For example, you must be 16 to write your driver's test, and you must be 18 to vote in an election. Unlike these things, in healthcare, making decisions is based on capacity, not age. Making decisions about your health. The decisions you make about your own healthcare are governed by a set of laws. These laws state that your healthcare provider needs to know that you are capable or have capacity to make decisions about your health. In healthcare, capacity has a special definition with two parts. 1. Understanding, meaning your healthcare provider needs to know that you understand the information about the decision you are going to make. And 2. Appreciation, meaning your healthcare provider needs to know that you appreciate what your decision, or not making a decision, and the consequences of the decision mean to you as a person. Let's look at an example. You have an ear infection caused by bacteria, and your doctor recommends you take antibiotics to treat the infection. To make sure you are capable of making the decision to take antibiotics, your doctor has to confirm that you understand the infection may not go away on its own and could cause damage to your hearing if you don't treat it. The doctor will also have to make sure that you appreciate what the decision to take antibiotics means for you. If you choose to take antibiotics, you appreciate that you want the infection to be cured so you don't lose your hearing. You also appreciate that while you may not like the side effects of antibiotics, it is still better for you to take the antibiotics to get rid of the infection than to refuse treatment. Is there a minimum age for consent in healthcare? In Ontario, there is no minimum age for consent to medical treatment. Everyone is assumed to be capable unless a healthcare provider determines they are not capable. But just because you're capable of one decision doesn't mean you're always capable of making every decision. A younger child can make some small decisions but may still need help from a parent or caregiver to make more important decisions. Sometimes it's obvious when someone isn't capable of making a decision. For example, babies and people who are unconscious are not considered capable. In other situations, it might not be so clear. This might be because the person is suffering from a physical or mental illness, or they are a young teen who is still maturing. If you aren't capable of making a decision about your health, a substitute decision maker will make the decision on your behalf. For children and teens, this is usually your parent or caregiver. Substitute decision makers are required, by law, to make the best decision for you. This means they must make the decision that is in your best interests. To make this decision, they need to have access to your personal health information. A substitute decision maker may be given access only to PHI relevant to the specific decision, not access to all PHI. Number 3. Confidentiality. Confidentiality means to keep something private. For example, you tell your friend that you have a crush on someone and ask them to keep that information private or confidential. For personal health information, or PHI, confidentiality means healthcare providers have to follow a set of laws that say your health information can't be shared without your permission. But some information can't be kept private for safety reasons. We'll talk more about that in a minute. PHI includes your name, your birthday, upcoming health appointments, medical history, medications, lab or test results. If you are not capable of making a health decision about a specific treatment, then information related to that treatment will be shared with your substitute decision maker to help them make the best possible decision for your health. There are some exceptions to confidentiality laws. In Ontario, if you are 16 years old or younger, healthcare providers are required to report the following information to Child Protection Services. If you say that you are going to seriously hurt yourself, if you say that you are going to seriously hurt another person, if you say that someone is hurting you, for example, physically, sexually, or emotionally abusing you, if you say that someone younger than 16 years old is being hurt, for example, physically, sexually, or emotionally abused. A healthcare provider is required to make a report to the Ministry of Transportation for anyone who has a condition that may make it unsafe for them to drive. This may include a medical condition, such as epilepsy, or a mental health condition, such as a substance use disorder. What is your circle of care? You may be wondering if all healthcare providers can access your PHI. Your circle of care includes all of the healthcare providers who are caring for you. It allows them to share your PHI with each other without needing your consent. What is a lockbox? You can block healthcare providers from sharing your information, even within your circle of care. At any time, you can request any portion of your PHI to be placed in a lockbox. Any person in Ontario who is capable of making their own healthcare decisions may put any part of their PHI in a lockbox. PHI within a lockbox can only be accessed by healthcare providers with your consent or in an emergency. Finally, let's talk about some of your other healthcare rights. If you have capacity, you have the right to make decisions about specific treatments you receive. To make the best decisions for yourself, you have the following additional rights. You have the right to be informed. This means you must be provided with all the information you need to make a decision, including information about a treatment, information about side effects, possible alternatives to treatment, and information on what happens if you refuse treatment. You also have the right to make a voluntary decision. You must make the choice freely. You cannot be forced or coerced to make a certain decision by either your parents or caregivers or your healthcare providers. You can always ask your parents and your healthcare providers to help you make a decision, but it must be your choice. Finally, you have the right to refuse treatment. You have the right to refuse any treatment, even if your healthcare provider or your parents feel that treatment is in your best interests. You can also refuse to be examined by a healthcare provider. However, if you do not have capacity, you cannot refuse treatment. It's important to know that you have rights when speaking with your healthcare provider. Remember these key terms. Consent is giving permission for something to happen or agreeing that someone will do something on your behalf. Capacity relates to your ability to make decisions about a specific treatment. Confidentiality means to keep something private. If you are capable of making a healthcare decision, then you have the right to give consent and the right to keep your PHI confidential. You also have the rights to be informed, make a voluntary decision, and refuse treatment. For more information on consent, capacity, confidentiality, and other teen health topics, visit teens.aboutkidshealth.ca. For more information about your rights in Ontario, visit www.ontario.ca.